Hello, hello. Welcome to the Fertility Confidence Podcast. Thank you for hitting play today. And we are going to take some time to talk about one of my favorite vitamins / hormones, and that's vitamin D. And it is probably one of the most talked about health-related trends I feel in the last couple of years with what we've been going on across the world. But with fertility, it's also incredibly important. And we actually have a lot of really, really interesting research. So I wanted to share a newer study, a 2022 study that came across my desk a couple months ago, and then also share a little bit more information about truly why this is incredibly important. And similar to last week's episode where we talked about how sometimes our original fertility workup, our like a basic fertility assessment is really missing some pieces and has some huge gaps. This is something that I am still not seeing tested across the board with all men and women who are struggling with infertility. And my hope is in my lifetime, we will see it actually be a part of the standard assessment. But sadly, it just is not. And for some context, and if you don't know, I live in Southern Ontario. So obviously things are different, in all different parts of the world, wherever that you live. But here in Ontario, our healthcare system does not pay for vitamin D testing unless you have met specific requirements of having a specific malabsorptive disorders. Then they will pay for it when you go and see your practitioner. So regardless, it's something that we're not getting covered here in Ontario under our basic health insurance. Maybe that's why clinics and practitioners aren't running it often, but honestly, for $40, $45, we can get so much information about your body, your health, and your vitamin D is just the research that is coming out again, outside of fertility, that's so incredibly important to have good, healthy vitamin D levels. So let's take it back to the study that started it all today with vitamin D. It came out, like I said, last year. It was a meta-analysis, women's vitamin D levels and IVF results. So they pooled thousands of women doing IVF. They looked at their vitamin D levels and their overall success with their IVF outcomes. Long story short, they found that women who fell in that sufficient vitamin D category, and we'll talk about numbers in a second, had significantly higher significantly higher pregnancy rates, ongoing pregnancies, and live births. And if you've been following along with the podcast, you'll know that I'm always preaching the research that we use. We really want to make sure we're trying to find studies that are actually looking at live birth rates, because it's one thing to have more embryos in the freezer or to have more pregnancies, but is that actually equaling live births? And so with having sufficient vitamin D levels, we're seeing more positive IVF pregnancies and births. So we're talking about 3 different levels. They break it down into sufficient. The middle category is considered insufficient, so what we would call suboptimal, and then the third category being deficient. So I actually have the conversions. I'm going to grab my sticky note because you Americans speak in different languages, different unit languages than us Canadians do. So what they deem sufficient is greater than 30 ng per ml, which is equal to 75-ish nanomoles per liter if you're in Canada. So if you're in Canada, we're looking at 75. If you're in the States, we're looking at 30 being sufficient. I'm going to talk in a second why that's our bare minimum. That's what they consider normal. It's not what we actually consider optimal, and I'll explain that in a second. That middle category is anywhere between 21 and 29 ng per ml, or we're looking at 50 to 73 nanomoles per liter. And then you're deficient if you're less than 20 ng per ml or less than 50 nanomoles per liter. That's considered deficient. So first and foremost, bare minimum, we should be ensuring that all women who are trying to get pregnant have a vitamin D level higher than 75. Bare minimum, okay? And that's, like I already said, that's actually not what we consider optimal, but it's like our bare minimum normal. Anything less than that, we are seeing lower pregnancy rates in IVF, okay? And we can extrapolate that data to women doing IUIs or trying in unmedicated cycles, knowing that there's something there with egg quality, implantation, probably progesterone production. There's a whole slew of reasons why that might be an issue, okay? So this study is specifically looking at just vitamin D status and IVF outcomes. And it really got me thinking about how much vitamin D impacts so many aspects of fertility, and yet we're still not screening for it regularly. We have seen really cool research specifically in vitamin D and AMH. And AMH is like such a hot button topic with so many women. I still, we have an old YouTube video out you can check out about AMH and on the podcast as well, if you scroll all the way back to the beginning, where we talk about how AMH is not a fertility dagger anymore. We used to use AMH to fully drive decision making, but the reality is that AMH is not a predictor of clinical pregnancy outcome, meaning it's not a predictor of your success. Women with low AMH can get pregnant and have live births, and women with high AMH may not. It's actually not the best way to understand where to go from here in your fertility journey. And it's not even the best way to understand ovarian reserve. And a lot of times we're hearing that you can't change your AMH. It just is what it is. And the reality is that's actually not totally accurate. Your AMH changes cycle to cycle. The amount of small follicles that your body's able to recruit is different every single month. It's never going to be the same. It is going to fluctuate, and that is normal. We also can change that AMH for the better. And a lot of times I'm hearing clinics saying like, no, you absolutely, once you have this AMH, your egg level is low, we should just go into IVF. And I always ask further questions about that because we have studies with vitamin D specifically showing that replenishing vitamin D status actually can increase your AMH levels by 13%. It's not that much, but when we're talking about the difference between, having 5 extra follicles being recruited, that is the world of difference for someone with premature ovarian failure or premature ovarian insufficiency. Like 2 extra follicles can make the world of difference. So we know also from the research that there is some seasonal impact with AMH, which is kind of super cool. But it's just the level of your body's recruitment to the eggs. And if we're not able to recruit those eggs properly, we're going to have lower levels. How do we actually get a better accurate look at ovarian reserve? You have AFC counted during an ultrasound between day 3 and 7, ideally. That is a more accurate representation. And even that's going to change cycle to cycle. So this is like a huge digression away from our vitamin D topic, but I thought that was important to note because we can see in the research that actually treating your vitamin D deficiency, replenishing your vitamin D to optimal levels actually increases your AMH, meaning we're having more follicle recruitment, more follicles available cycle to cycle. Who wouldn't want that? That's going to increase your chances of conceiving each and every single cycle. We also know that vitamin D deficiency impacts your thyroid, both your actual T3 and T4 hormones, but also if you're someone with Hashimoto's, if you have autoimmune hypothyroid, vitamin D deficiency is strongly correlated to worsening antibodies. And a treatment for lowering antibodies is improving vitamin D levels. We know that antibodies and autoimmune hypothyroid is maybe still a little bit misunderstood in the fertility space, but we do have some studies showing increased miscarriage risk with Hashimoto's. And so we want to manage that. With our women who have PCOS, we know that vitamin D deficiency is strongly correlated to worsening insulin resistance and other metabolic markers, meaning we want to actually work on the insulin piece through nutrition and lifestyle and supplementation, but treating the vitamin D deficiency actually treats the insulin resistance. as well. We know that women with endometriosis are more likely to be vitamin D deficient. We know that women who have recurrent implantation failure are more likely to be vitamin D deficient. We know that there's some impact with immune health and how the immune aspect of infertility in the uterus, which is vastly misunderstood, definitely correlates to your vitamin D status. So why are we not testing this across the board? I don't know. I do. Because it's worth it. We get valuable information. And this is just fertility. We're not even talking about the fact that we're seeing more correlation with specific cancers and vitamin D deficiency. We're seeing worsening of cardiovascular health with vitamin D deficiency. Like, I could go on and on and on. There's a lot to do with mental health, with our immune health, with our brain health. Vitamin D plays a huge role in so many processes in our body, but especially when we're talking about conceiving. Now, I mentioned I wanted to share a little bit about why I believe we actually need to go higher than that sort of 75 nanomole cutoff range in terms of getting into the optimal. And that's because there is a study specifically done in women with PCOS. So I always want to be transparent with that. But they actually found that each 2.5 nanomole increase in vitamin D increased the live birth rate by 2%. So if you're at 75, every 2.5 or 3 nanomole increase above there actually was correlated with an increase in live birth rate by 2%. How cool is that? Live birth rate in this population increased 4 times in women who had a vitamin D over 112 nanomoles. 112 is very different than 75, right? So if 75 is considered normal, but we can actually increase live birth rate by taking that vitamin D above 112. Why wouldn't we do that? Live birth rate also was reduced by 44% in women whose vitamin D was lower than 75, so lower than that sufficient. 44%, that's almost half. That's crazy. Any vitamin D higher than 95. So any woman in the study that had a vitamin D higher than 95 nanomoles, and I apologize, I don't actually have the conversions handy. Anyone above 95 nanomoles actually decreased the risk of miscarriage by 82%. So when we're looking at this 2022 study saying, hey, we noticed in this large study, like almost 4,000 women, when they had vitamin D higher than 75, they had a higher live birth rate. And then we compare that to the study that says, hey, we can actually increase the live birth rate if we go even higher than normal, if we go into more of an optimal range and reduce the miscarriage rate by almost half. How wild is that? How insanely powerful can vitamin D be for some women? This is why it's so incredibly important that we are checking your vitamin D. We are not just assuming that you are deficient because you live in Southern Ontario or Montana or wherever the sun doesn't shine for 10 months of the year. We are testing because vitamin D is a fat-soluble vitamin. There is such a thing as too much, and there's such a thing as too little. So right now, Health Canada is requiring everyone should just take 2,000 IUs of vitamin D a day. 2,000 IUs of vitamin D is actually okay for people who have already decent levels of vitamin D. But if you are deficient, what I've seen in clinical practice is 2,000 IUs is not going to do you any good. It's actually not going to replenish your vitamin D into sufficient or optimal levels. We need to go higher, but I don't want you to just go out and start taking thousands and thousands and thousands of IUs of vitamin D without testing, because toxicity is potentially an issue. With it being fat soluble, we aren't just peeing out the excess like we would with a B vitamin or vitamin C. It stores, and those stores will then impact our bone health and our heart health. We don't want that, okay? It can impact our thyroid negatively. So we want to make sure we're actually testing and then we're replenishing levels with an appropriate and specific dose of vitamin D for your body. If you are in Ontario and your family doctor will not run this testing, know that naturopathic doctors who have done specific prescribing exams, so you need to actually have a separate prescribing license here in Ontario, we can order and prescribe appropriate levels of vitamin D for you. If you are in the US and your doctor won't run this for you, know that you have options to get this testing done, and finding functional medicine practitioners, other practitioners that share these values, working with us inside Fertility Confidence Method to help guide you through the process of what this will look like and how this potentially one teeny tiny piece can drastically change the outcome of your fertility experience, which is pretty cool if you ask me. So hopefully this was helpful for you guys today. As always, let me know if these episodes are resonating with you. Write a review, subscribe to the podcast so that you don't miss any future notes from me, and I will see you guys in the next one.